Thank you for coming today. I know the weather is snowy and cold outside, so I appreciate you taking the time to come. Can everyone hear me in the back? Can you hear me? Yes. Thank you so much for the introduction. As she said today, I'm going to be talking about healthcare. I have a background in healthcare administration, and when I was attending a different talk of a friend a few weeks ago, Dr. Shin asked if I would be willing to talk about the differences between Korea's healthcare system and America's. I agreed before thinking. And I had to do a lot of research for this talk because healthcare is extremely complex, and I had to learn a lot about both the American system of where I'm from, as well as the Korean system. So I invite you today to learn with me, and I really appreciate feedback at the end and see if we can get a discussion going. Okay. So my background, I have a degree in health sciences, which is a combination of public health and hard sciences, like biology, from Truman State University in Missouri, which is a place in the middle of America that you don't need to know about. During my college years, I interned at an organization called North Carolina Prevention Partners, an advocacy group that lobbies for increased physical activity, the improved nutrition, and stopping of using tobacco products. After graduating, I worked at the University of Wisconsin Carbone Cancer Center, and I have a strong interest in health. I like learning about it, I like exercise, I like nutrition, and I like talking about it with people who are also interested. The place where I worked has a comprehensive distinction from the National Cancer Institute, which is the large body from the federal government that has to do with cancer in the United States. And the University of Wisconsin has a comprehensive designation, which means that the university has services and sees a number of patients that allows them to get extra grant money from the federal government. Over 30,000 patients are seen annually at the Cancer Center, and it's ranked in the top 25 for cancer care in the US. Interestingly, the research group I worked in, part of my time there, had done some international collaboration with the Asan Medical Center in Seoul. My job was working with clinical trials. Clinical trials are how new drugs and new therapies are tested. And the way that's done is patients are enrolled onto a trial and they receive a very specific treatment, and rules are very closely followed. That way, at the end, the results, the patient's well-being and outcomes is analyzed, and that's how we tell if certain drugs are more effective than others. It's how new treatments are developed. I worked with a group called the Wisconsin Oncology Network, or WON, and is comprised of 19 sites in a 3-state area: Wisconsin mainly, Illinois, and South Dakota. My job involved protocol writing, developing budgets, and following federal rules and regulations. I also did a lot of email and communication because, as you can imagine, we had patients seen all over the state, and so we fielded a lot of questions about how the protocol should be followed. Disclaimers, and there are some. This is the most flattering picture of me I can find. I'm not an expert. I'm a student learning about this as well. So if there's anything I say that you've heard differently, please feel free at the end to bring it up. I'd love to hear from you. I learned a lot putting this talk together. I did a lot of internet research, and I did speak to a friend back home who works in healthcare, and then also a few Koreans about their system. I tried to pull the most recent data when I could, and healthcare is a very complex topic, but we're crunching it into a very short amount of time. So please bear with me for the oversimplification. Okay, today we're going to have a warm-up. This is what I always do with my classes at Hog 1. We're going to talk about what health is, how we measure it, what factors affect it, how people access and pay for care that they need. We're going to look at different healthcare systems, and then we'll draw our final conclusions. Or warm-up. Okay, I want you to take a look. I want you to scan yourself. How healthy do you think you are on a scale of 1 to 10? 1 to 2, you're not doing very well. 9 to 10, you are a model of health. So I want people to raise their hands. If you're 1 to 2, don't be shy.
I'm just honest.
3 to 4? 5 to 6? 7 to 8? And a 9 to 10. People were too honest. There are some of you out here I know are at least a 9. Which country in the world do you think has the healthiest citizens?
Norway.
Norway?
Sweden.
Finland.
Japan.
Japan.
Okay. How about the best healthcare system? Norway. How about the opposite? Worst healthcare system in the world. What do you think of?
Nigeria. Uganda.
I was thinking America, but that's okay. And think of the healthiest person that you know. Why is he or she so healthy?
She's still alive.
We'll talk about it. Thank you. Thank you for participating. The World Health Organization defines health as the state of complete physical, mental, and social well-being, not merely the absence of disease. So I think that's an important point to note. Health isn't just not being sick, it's actually being your best self. In the last 100 or so years, 150 years, great progress has been made in healthcare. We've learned a lot about what causes disease, bacteria, viruses, basic sanitation, sterilization, and the development of antibiotics obviously was huge. So many, many lives have been saved. In fact, the problem now is that people are debilitated by chronic diseases or diseases called lifestyle diseases. Things like cardiovascular issues, diabetes, respiratory ailments, and cancer. So today, I want you to think of our discussion from a chronic disease perspective. Obviously, some of the countries you mentioned with the worst healthcare systems in the world, what you think of, are still battling things like basic sanitation, the use of antibiotics, and money. So think of our talk from the chronic perspective today. How do you measure health? It's different for every person. What's healthy to one person is not to another. And I think it's different culturally as well. One way that people measure health is by life expectancy. And life expectancy is calculated in a number of years. And life expectancy is how long a child born in a given year can expect to live. In the last 100 or so years, the life expectancy worldwide has consistently been going up. There's an organization called the OECD, and I wasn't very familiar with them prior to doing research for this talk, but very interesting organization. They promote policies that improve the economic and social well-being of their member nations, and they have a ton of data. If you like to nerd out on numbers, you should go to this website. They have very interesting information on life expectancies in various countries. So I just pulled select countries. I tried to pick ones that might be roughly even. I didn't pull Nigeria. But as you can see, Turkey has the lowest of the nations I chose. The US has the second lowest at 78.7. And Japan, as a member of the OECD, has the highest life expectancy of any nations that are members of that organization. What factors affect health? It's true. Factors that negatively affect health. We all know them, but it's hard to get ourselves to do the things that we know make us healthier. Unhealthy diet and obesity are two very large problems, especially in the country where I'm from. I found a statistic in the OECD database that over 30% of Americans are obese. I think the percentage that are overweight is 2/3 of our country, compared to the obesity rate in Korea and Japan, which is 4%. Physical inactivity, we have lives that make getting physical activity something you have to choose to do. You have to choose to take the stairs, you have to choose to walk places. Our lives aren't set up to keep us moving, and our bodies aren't designed to stay sitting. Tobacco use is a huge problem, and I think rates actually may have leveled off in most developed nations, but in underdeveloped countries, rates are still increasing. Tobacco companies are funneling more money into bringing new customers into their pool. Excess use of alcohol and excess stress are also contributing factors. Obviously, genetics, your environment, bad luck, accidents, those are all things that also affect your health. Very important variable is how people access and pay for care that they need. Things to consider, and you don't have to raise your hand, but I'm just curious, how many of you today, if you needed to go to the doctor, could do so? Could do so easily and in a timely way, and could pay for it? In your country, does everyone have access to the same type of health care, same quality? And is healthcare a right or a privilege? Going back to the World Health Organization, the group that defined what health is, they condone universal healthcare. Their position is that access to good and affordable healthcare is not a privilege, it's a basic human right, and that everyone should have it. So approximately 50 countries in the world have universal health care or have something very close to it. The theory behind universal health care is that all people, regardless of their income level or their current health state, get the same coverage. So the idea is sick people and healthy people together means that you share the burden, you share the cost that is required to treat sick individuals. And you have the health care when you need it. You don't have to worry. I think the two most well-known countries are Canada and the UK. We'll talk about them a little bit later. But some other nations that have universal health care or something close to it surprise me. Now we'll take a look at South Korea's healthcare system as well as America's. The current Korean healthcare system started in 1977. Employees of organizations that employed over 500 people were first rolled into this health insurance program started by the government. The next group that was rolled in, the next group of citizens, were school employees and civil servants. By 1989, almost every Korean had health insurance, had the ability to get health care when they needed it. I found online that actually that took 12 years to accomplish, and that is faster than any other nation has done something similar. The National Health Insurance Corporation was identified as the single payer for all of Korea in 2000. So the current system as is has been in place for about 12 years. A very amazing statistic, over 96% of South Koreans are covered. There's an additional program, the MRP, for the remaining percent, and that covers people whose incomes are too low to be able to get insurance through the universal program. Citizens have a choice of providers. Within reason, I did hear some anecdotal information that if a person wants to see a very in-demand specialist, there can be significant wait times to do that, and you might have to pay more money out of pocket to do so. And citizens do buy private insurance for additional coverage beyond the government's basic service level. The HIRA, Health Insurance Review and Assessment Service, reviews charges that the government is paying for and ensures that they are kept at an even level and ensures they are fair. So the government is controlling prices that they're willing to pay hospitals and providers for getting patients. The system is paid for by the contributions that employed Koreans pay and the contributions that the employers of those employees pay. The government also pays for the system as well as a tobacco tax. I read that 6% of the funding for healthcare in Korea is actually gained from tobacco tax. And per capita, South Korea spends in US dollars just over $2,000 on healthcare annually. That's an important number and we'll come back to that. That's roughly 7% of the gross domestic product in Korea. The gross domestic product is the sum total of all goods and services that are bought or rendered within a country's border. So of all of the won spent in Korea in a year, about 7% of it is on healthcare. Successes and challenges that I read about online, and I would be curious to hear from some of you. Almost everybody has health care. There's a program in place for those that don't get it through the main government program. And this is incredible to me. In the 1960s, the health expectancy for Koreans was 51.1 years for males and almost 54 for females. By 2006, those numbers had risen incredibly. Obviously, there's a lot going on here. South Korea became an economic powerhouse. There are advances in care. There are a lot of different variables, but you have to wonder if the near universal healthcare coverage had a large role to play. Challenges that I also researched about are the South Korean population is getting older. There aren't as many young people to help support those that are aging. There seems to be a disparity between the type of care that the wealthy can get and the poor can get. And hospitals are concentrated in urban areas. So those that live in rural areas might not have as easy of a time accessing the care that they need. And like everywhere, costs are going up. That's always a problem when you hear about healthcare in the news. The election is coming up on December 19th. You don't have to work. You get to vote. I've heard that there's potential, depending on which political party takes control next, that the healthcare system could undergo some fundamental changes. I was told that providers in Korea don't make as much money as some of their peers in other nations because of the government system. That helps keep costs low for patients, but might not provide the compensation for doctors that they want. So there are some powerful lobbyists that are at work. I think it remains to be seen what will happen after this December 19th election, but it's possible that the government's role in healthcare could go down and the system could become more privatized. Somebody else who has a privatized system, or a sort of privatized system, So U.S. healthcare doesn't have the best reputation, I don't think, as someone who worked in the industry. I have not seen sicko, but my boss has, and that's what he knows about American healthcare. Koreans spend about 7% of the gross domestic product on healthcare. In America, it's almost 18%. The next highest country is right around 12%, and that's the Netherlands. So for every man, woman, and child in America, over $8,300 are spent on healthcare.
Is this per year?
Yep, annually. so expensive? We don't know. We're trying to figure it out. Some interesting information I read. People hypothesize that overuse of antibiotics, medical errors, administrative inefficiency, and preventable conditions, those lifestyle things we were talking about earlier, all play a role. But honestly, costs are out of control and you don't have a good way to know why or what to do about it. So you have your healthcare piece, and then you have your insurance piece. Often they go very closely together, at least in most developed nations. In my country, according to the 2010 census, almost 60 million Americans didn't have insurance. Because in America, your health insurance is very closely tied to your job for most people, young adults are especially hard hit. When the economy took a downturn in 2008, it became very difficult for recent college graduates to find jobs. A lot of them turned to part-time work, and part-time jobs don't have to provide you with health insurance. So a lot of young adults finish school, they're kicked off their parents' insurance plan, and then they're kind of floating. This is a pretty healthy population, so for the most part, it's not problematic. But sometimes it can be. A story that made headlines this summer was the premiere of The Dark Knight. There was a shooting in Aurora, Colorado. One of the victims was severely injured. I think he was shot in the face, and he didn't have insurance. And I don't know what's become of his story, but there was a lot of media attention because his medical bills had risen to over $2 million. So he's liable for those, even though he doesn't have insurance. So any assets he had can be seized. And finally, there was a Harvard University study in 2009 that found uninsured patients are twice as likely to die from a visit to the emergency room as insured patients. Now that's kind of a sensational statistic when you look at it. I think there's probably a lot going on. It could be the type of hospital that uninsured patients are going to. It could be difficulty communicating with providers for these uninsured patients. It could be issues with managing care, transferring patients to different specialists or different hospitals. So it's not saying if you don't have health insurance and you go to the emergency department, you're probably going to die. It's saying that there are a lot of factors that influence your care, and not having insurance makes things even more difficult. Some bright spots. America has some of the best care in the world, and also some of, not very good. But I think that the center where I worked, the cancer center, I was amazed by the treatments that scientists were developing, the level of care that patients were getting. There's a lot of innovation, there's a lot of new treatment options being developed, and there are a lot of specialists in America. There's actually a shortage of primary care doctors. So if you have a rare condition or if you need a risky procedure, America is a good place to be if you have insurance. And I can't make sense of this last bullet. I found one survey that said almost 30% of Americans rate their health care as very good. They're extremely satisfied. I found another one that said over 75% are. I wonder if the people that have care have excellent care. The people that don't have care don't have care. It seems like there's a big gap. The middle is missing out on even average health care. So what can we do about it? President Barack Obama made history March 23rd, 2010, when he signed the Affordable Care Act. The Affordable Care Act is the largest overhaul to the American health care system in decades. And the American healthcare system is a $2.8 trillion enterprise. And this is a very big deal. And if you want to start a debate or fight, you can talk about healthcare policy in America. People get really heated about it. And there was actually a challenge as to whether the legislation was constitutional. And the Supreme Court ruled in a 5-4 decision that most provisions of the plan are constitutional. They don't go against the basic tenets that America was founded upon. The main argument was whether the government had a right to force people to buy something. And in that case, forcing them to buy private health insurance for themselves. The Supreme Court ruled that the individual mandate, the requirement that people buy care for themselves, is constitutional because the fee is a tax, and the government is allowed to tax. Now, what they didn't rule constitutional was whether governments could be, states were required to expand their Medicare programs, their Medicaid programs for low-income individuals. So it remains to be seen how that will be fleshed out. A big provision in Obamacare is making that net wider, the Medicaid program, ensuring that more low-income people have access to services. It's a pretty lofty goal. Give health insurance to 30 million more people and improve care. So Obamacare, the Affordable Health Care Act, will affect not only the public sector, but also the private sector as it changes to accommodate the new laws. One thing I should mention is that parts of the legislation are already being rolled out, but it won't fully be in place until 2018. Some of these ideas are just so common sense, I was surprised that they're not being done now. The government is going to start rewarding healthcare providers for keeping people well and for making them healthy more quickly. Right now, our system is set up so that providers that give a lot of care are rewarded financially. When really we should reward the people that are keeping citizens healthy, or if they are sick, bringing them back to health in a quickly and low-cost manner. There are lots of important details to Obamacare. I'll just go over a few of them. I was talking earlier about young adults often falling into that black hole where they don't have insurance if they can't find a full-time job. This legislation allows young adults to stay on their parents' insurance until age 26, regardless if the young adults are students, if they're married, if they're employed, it doesn't matter. You can stay on your parents' plan until you're 26. The government is going to require citizens to buy their own health insurance if they don't get it through a job. The way they'll do that is they'll give tax breaks. They'll give more money back to that individual so he or she can afford a private plan. If people don't do that, the government will fine them. Costs for 2014, the first year that this law will be in effect for the individual mandate, $295 a year. By 2016, that price will go up to $695. Oh, exclusions: if you're in jail, you don't have to have private health insurance. If you're unemployed for 3 months or less, you don't have to have private health insurance. Or if you have religious reasons, you don't have to have health insurance. A couple other really important things. Preventive care is being emphasized. It's now free, which is awesome. Keep people well instead of treating them after they're sick. Lifetime benefits have become a thing of the past. It used to be your insurance company could tell you, over the course of your care, your life, we will pay for services up to X amount of dollars. So that became really problematic for people with fibromyalgia or other conditions that required care and would require care throughout one's lifespan. Those ceilings have been taken away. The other thing that I think is amazing is that pre-existing conditions have been removed as well. It used to be your insurance company, if you were applying for health insurance, the health insurance company could go through all your medical records and they could say, If you have knee problems, or you did back in 1998, ooh, looks like you've had asthma since a child. Pre-existing, we will not pay for it. Of course you have pre-existing conditions. You're a person. That's how things work. It's now illegal with the new legislation. We don't know if it'll work.
Excuse me.
Yes.
It's illegal for a private company to reject people with pre-existing conditions according to the law.
I'm sorry, say that one more time.
I'm confused whether it's the government has banned private company to reject people.
Yep, they made it illegal for insurance companies to deny coverage based on pre-existing.
Really?
Yep. Yep. And I don't know if that segment is completely rolled in or if it's coming in 2014. I'd have to look, but it is illegal. It will be illegal. We don't know if it'll work. A lot of people that work in the healthcare industry are not happy with the new legislation. Some are. A lot of citizens think it's a good idea. Some don't. There's a lot of discourse and a lot of uncertainty about what the future holds for the healthcare world. So I only have a slide for Canada. I wanted more. But if we look at a couple other healthcare systems, we've looked at Korea and we've looked at the US. Canada is a country that has had universal healthcare for a long time, and they're pretty good at it. The Canadian health system is called Medicare, and they have a set of 13 different plans across their country that, taken together, provide a bottom line of basic healthcare. So everybody has at least a certain level of healthcare in Canada. This is a quote that I pulled from the website about what their aim is as a program. And going back to our numbers, Korea, 7% of the gross domestic product, the US almost 18%, Canada spends 11.3% on healthcare, and they have universal coverage. The UK has the National Health Service, that's their form of universal healthcare coverage. I read that the NHS is actually one of the biggest employers in the world. They insure 62 million people, and according to the website, if you have a heart attack or you go in for splinter removal, costs to you are the same. They're free at point of service. I don't know exactly how the costs work behind the scenes, and that can be something we can talk about at the end, but free at point of service is an important tenet. And Brits spend almost 10% of their gross domestic product on healthcare. So the question is, does more money spent on healthcare mean that people are healthier? This goes back to our life expectancy table that we looked at earlier. And the red line shows you the per capita spending in a year on healthcare in each country. So as you can see, Turkey has the lowest life expectancy, but they also have the lowest per capita spending. US has the highest per capita spending, but our life expectancy is just about in the middle. And then some of these other countries that we talked about, South Korea, Canada, the UK, kind of come out in the middle, but they have higher life expectancies. So this gentleman named Matthias Rump is a representative of the OECD, that Organization for Economic Cooperation and Development that I mentioned earlier with all the data. And as somewhat of a healthcare expert, he was interviewed, and he said that a low-cost, effective health system has these qualities. You emphasize primary care instead of hospitals. You keep people well instead of waiting until an issue requires treatment in an expensive hospital. You use generic drugs that work as well as name brand drugs. You keep tight regulations on costs so they don't spiral out of control. And you adhere to clinical guidelines, which means if a patient comes in to see a provider. The provider knows these are the symptoms, these are the possibilities, these are the likely possibilities. Not, it could be this, it could be that. Only ordering tests and services for which there's a reasonable need. Healthcare is a very complex issue. Not only all the things we talked about today are factors, but poverty, education, social classes, government involvement, and then the personal lifestyle piece are all important factors. I don't want to oversimplify, as I mentioned, but I wanted to give you kind of a snapshot of things that are going on in the healthcare realm. I don't think anybody really knows which system is better. I think people do PhDs on this stuff. They study it for their lifetime goal. And hopefully we're moving in the right direction, at least in my country. It remains to be seen. So I want to get on my soapbox for just a minute. The best approach in the meantime, I think, is preventive healthcare. $36 million of the 57 million deaths in 2008 were due to non-communicable diseases. Non-communicable means chronic. So these are things that our lifestyles greatly affect. WHO estimates that 80% of premature heart disease, stroke, and diabetes are preventable. And I think the best course for us is to try to control our own health as much as we can. Obviously, there are health issues that fall outside of your control, but it's nice to know that you at least have some autonomy, you have some control into improving your health on your own. Some additional questions that I thought of, and maybe you have some of your own to add. It's interesting to think about what financial responsibility a society has to its citizens. Is healthcare a privilege? Is it a right? Is it possible that there's not one perfect healthcare system for all countries? Maybe given differences in people's lifestyles and cultures, maybe there are different systems that work better for different countries. And I think it's important to know what your politicians think about healthcare and how they plan to change it or keep it the same. Thank you.
Hello everyone, my name is Eric Banuelos, and now it's time for the question and answer portion of the talk. If you didn't receive a piece of paper when you first came in, please raise your hand and one of our volunteers will give you one. We ask that you please refrain from raising your hand to ask your question directly. We prefer that you submit it through paper form. Okay, so first of all, can you tell us a little bit about where you grew up and when you started becoming interested in health?
I'm from the state of Iowa in the U.S., which is in the Midwest. I grew up in a small town. The closest big city to me, really big city that people would know is Chicago, and that's 6 hours away. When I was younger, I played a lot of sports. My family was pretty active, so I think I just got used to exercise. And I don't know why I'm interested in nutrition. I just think it's such a fascinating idea that what we put into our bodies can impact our health so much.
What influenced your decision to teach abroad and specifically in Korea?
Well, as I mentioned, I worked in administration for about 5 years, and it definitely capitalized on my interest in health, but I'm not a desk person, and I thought that the Cancer Center was doing really good work, but it was hard for me to feel like I could see the results of those efforts. I wanted something that was more interactive, where I could work with people. And I'd always thought about teaching, but I've been too intimidated to try it. Speaking in front of people makes me nervous. But I don't know, after a couple of years of kind of having it float around in the back of my mind, I decided I wanted to get my TEFL and just try teaching back home, which I did. I really liked it, and I started doing research about which countries would be interesting to travel to, and Korea was at the top of the list.
So this is the biggest question I had about the difference in healthcare systems. Why does a doctor's visit in America take longer than one in Korea?
Koreans do everything faster. I don't know. That's a good question. Maybe the number of patients that a Korean physician is seeing is greater. Maybe they have more of a quota they have to fill. Anybody have any ideas?
It was just something that struck me because the first time I went to the doctor here in Korea, I was in and out in 10 minutes.
Really?
And I mean, average doctor visits in America for me were like, around an hour. So, yeah, I was just curious. So, can you talk about the public option in the U.S. and give your thoughts on its future?
As in the governmental healthcare?
The healthcare, the public option that wasn't accepted.
I don't think I could talk intelligently about it. Sorry.
The cost of healthcare in the U.S. is increasing dramatically. Who benefits when prices go up?
Well, somebody must be. I think historically, insurance companies have made pretty good money. And I think that the medical community, especially specialists, because it's very expensive to see them, have also made pretty good salaries.
What prevented universal health care from coming to America long ago?
I think that there's a strong resistance to a large government presence. I think that people are really wedded to the idea of private is better, and it feels uncomfortable, it feels scary, it feels un-American to think that the government would come in and change the system. And I think that there's a lot of money to be made in healthcare. It's a very capitalistic society, but a lot of places are. So I think it's just how things have been historically, and there's never been a time when an opportunity for change, when there's been enough support.
How can they assess whether healthcare providers are making people healthier?
The information I read online is that the government is going to start keeping more tabs on clinical outcomes. So, for example, if you have a patient who comes in for, I don't know, valve replacement or some type of heart surgery, you look at how many days those patients had to stay in the hospital after surgery to recover. When were they well enough to go home? The idea being that if surgery is better done and care is better dispensed, that patient will return to health more quickly and won't be in the hospital as long, so costs will be lower.
Which country's health system are you most envious of, and why specifically?
Who asked that? Got me twice. I don't know much about the Scandinavian countries and their healthcare systems, but what I've heard is that they're amazing. Like, they have this great universal coverage, and like their citizens are so healthy. It just sounds like this utopian thing to me. So I would be really curious to learn more about what they put into place. And I'd like to learn more about, like, the Korean system was very impressive to me. I just didn't know much about it. So I really like some of the tenets of the Korean healthcare system as well.
Are there any success stories for mostly privatized healthcare?
I don't know the answer to that. I'm sure there are.
What are, if you are aware, what are the Korean candidates' healthcare positions?
I talked to my boss about this, actually, and it sounds like one party, and I don't know enough about the Korean political system to talk about this well. I would welcome the Korean talking about it. It sounds like one party wants to move more toward the privatized system, or at least sort of privatized with less government influence, and the other party more wants to keep the status quo.
Okay. Here's the final question for today. Do you have any experience with traditional Korean medicine?
No, a lot of times at school dinner, our vice director will pluck something with her chopsticks and she'll say, good for health, good for health. But I really don't have any other experience with it beyond that.
Okay, so that's the end of the question and answer portion of the talk. Let's give our speaker another round of applause, please.